Hello, everyone, and welcome to Connecting the Dots with Dr. Ashaye. I'm your host, Lola Ashaye. I'm a primary care physician and owner of InTouch Primary Care in Sugar Land, Texas. I am so excited you are here. This is the place to be if you desire to take charge of your health and you want to make sure you're doing all you can to live a healthy lifestyle. Remember, you can always listen to this episode and all our episodes on the InTouch Primary Care YouTube channel. Leave comments, share, subscribe. Make sure you share with somebody that might need it. Today is a good day. I'm going to be discussing an important topic. Shout out to my family member, Sis, for asking this question. You know who you are. And the question is, what can I do to prepare for menopause? So to those that have listened to our previous episode, you know that I'm all over this, so excited about this topic, because anything that we can do ahead of time to prevent health conditions, that's right up my alley. And I want us all to have good health so we can have the opportunity to live fully and actually enjoy all that we work so hard for. Being healthy is so important. Health is wealth, right? So let's jump right in. So what is menopause? Menopause is one of those things that is figured out after the fact. It is defined as 12 months without a period. So if you've gone 12 months without a period, then we say that you're in menopause. And the median age for menopause is 51, actually 51.4, but 51 years old, that's when the median age for menopause occurs. And it basically means that the woman no longer has follicles or has very few follicles left in the ovaries. And with very few follicles means a lot less estrogen. So most people are aware that during menopause, hot flashes is one of the main symptoms of menopause, and 80% of women will experience hot flashes during menopause, some mild, some more severe. So women younger than 50 or 51 obviously can go into menopause. 51 is just the median age. But if a woman is younger than 45 and starts to have irregular cycles, hot flashes, and obviously if the pregnancy test is negative, they should be checked for other conditions that can look like menopause, things like thyroid disease or hyperprolactinemia, just to make sure that it's nothing else and, aside from menopause. So this is important because there is an increased risk of heart disease and bone loss and even concerns with cognitive function that people have, and that people that have early menopause, which is if you have menopause between 40 and 45 is considered early, or people that have primary ovarian insufficiency, that's if you have menopause before age 40. So people that have menopause too early can have increased risks of significant health conditions. And so we want to know, is this menopause? Is this something else? And so there should be additional testing. But for the most part, most people will have menopause, around age 51. But most people will experience what we call perimenopause, a transitional phase before menopause. And this transitional phase can last an average of 4 years. And usually women will have irregular menstrual cycles. They might have symptoms like hot flashes, sleep disturbances, mood symptoms, vaginal dryness. A lot of the symptoms that people can experience during early menopause, they could have during this transition. And many will notice a change in their periods. They will notice that there is more time between their periods in some cases, or it might be heavy, or they may bleed longer. And they may also just experience all the other symptoms I mentioned. And this can also, during this transition period, they may also notice that their cholesterol profile changes, when they check their lab work. And it's important to know that bone loss has started to occur during this transition. So Those are the things that can happen in the years before menopause. So a very common question I get is, can I be tested to see if I'm in menopause or when I'm going to be in menopause? And the answer is, it's typically not necessary to test for women if they're 45 and over, if they have symptoms that are consistent with menopause, except you think something else is going on. But if the symptoms are consistent with menopause, their cycles are irregular, they're having hot flashes, and you're not suspicious anything else is going on, testing may not be necessary in that scenario. There are several tests that can be done, but the issue with the test is because the hormonal levels vary so much in that transitional period that sometimes it can be misleading if you get a value that, and it doesn't really change anything you're going to do for the most part. In addition, it doesn't predict whether or not you're going to have symptoms. So there are things you can do to prepare, but testing doesn't often change too much of what you're going to do, except you're thinking there might be something else going on. So again, the way we know for sure that a person is in menopause is if they have not had a period for 12 months, and then we call it menopause. So the most common symptom, hot flashes, and hot flashes, people, it's basically a sensation of heat that a woman will experience. It usually will last for 2 to 4 minutes. And many women will have some sweating, profuse sweating with it. Sometimes they'll have palpitations, like their heart beating faster than usual. And then after that, they may have some chills, some shivering, a feeling of anxiety. So obviously not all women will experience all these symptoms. Some women will just have very mild symptoms and others will have more symptoms. The hot flashes are most common during that transitional period before menopause, before the period stops completely, and into the first few months to years of menopause. But they can actually last many, many years in some people, up to 20 years. So depending, again, if it's really bothersome, we'll talk a little bit about what needs to be done. So hot flashes can cause sleep disturbances, but sleep disturbances, even aside from hot flashes, can happen in that transitional period as well. And that can just be a primary sleep disorder that has developed, or sometimes it's related to hot flashes, anxiety, depression, or restless leg syndrome. So there are other things that can cause problems with sleep during that transitional period. Another thing that can occur that is important for women to be aware about is new onset depression. So there's a higher risk of new onset depression during that transitional period when you're going from having regular periods to when it's irregular to when the periods stop completely. And it's important to note that there is a higher risk. That risk lowers again after menopause has been, after that transition is complete and a woman is in menopause, but there is an increased risk in that transitional period. So I know many people have heard about hormone replacement therapy, so menopausal hormone replacement therapy. And typically that's done with estrogen with or without progesterone. And that depends on the person and their risk profile. And basically, hormone replacement therapy can be an option for people younger than 60, especially when they have significant symptoms that's affecting their daily lives. So whether or not you should get hormone replacement therapy and the type of hormone that is recommended will have to be determined by a doctor. The main goal of hormone replacement therapy is to reduce your symptoms like hot flashes, anxiety, vaginal dryness, but it can also help with other symptoms like anxiety, depression, sleep disturbances, especially if they're related to, the symptoms that you're already having. And even in some cases, they can help with joint aches and pains. The hormone therapy may respond to that as well. Or the symptoms may respond to hormone replacement as well. So, however, hormone replacement therapy is no longer recommended for prevention of chronic conditions that occur with menopause. So there are chronic conditions that the risk of certain chronic conditions occur with menopause. And we'll talk about that shortly here, but hormone replacement therapy is not recommended to prevent those things. Hormone replacement therapy typically can be used for 3 to 5 years, and then usually it's recommended to switch to something else, like a non-hormonal option, if the woman still has symptoms, or the other option will be to just lower the dose and monitor closely. But there are many different ways it can be given. It can be taken by mouth orally, like patch, you can even do an IUD, but there are different ways that a woman can receive hormone replacement therapy, basically replacing the estrogen to help with symptoms of menopause. Either way, all those different methods work. It just depends on, they work pretty equally. It just depends on what a woman can tolerate, and they would need to talk to their doctor about risk benefits of that type of treatment for their symptoms. So, as I mentioned, hormone replacement therapy is geared towards symptoms, particularly hot flashes, vaginal dryness, not recommended for prevention of long-term chronic diseases like coronary artery disease or heart disease, or not really recommended for prevention of osteoporosis, which is bone loss, or for cognitive function or prevention for dementia. So we're not using hormone replacement therapy to prevent things, is really mainly for symptoms at this time. So, but we know that even up to as soon as a year leading up to the final period that a woman will have, they start to lose bone a lot faster, and that they are higher risk of heart disease. In addition, the risk of bone loss and cardiovascular disease and possible osteoarthritis and cognitive decline also increase with menopause. So even though we know that there's a higher risk of these things, there is not that we need to work on preventing these things even before they occur, knowing that there's a higher risk of it with the lower estrogen. Okay, so how do you prepare? The first thing I would say is, as a woman, when you get into your 40s, or even prior to that, if you notice symptoms, talk to your doctor. Talk to your doctor about your risk. Figure out what your risks are. Your risk for heart disease, your risk for bone loss, those are the most serious long-term consequences of menopause. And then make sure that you're doing all that you can to reduce those risks now. Don't wait until you're in menopause, because like I said, menopause is typically a diagnosis that is made after the fact. And we know that changes occur in the body of a woman, even as early as 1 year before they actually have their final period. So it's important that the sooner the better to start discussing your risks and trying to figure out what your risks are. You'll be ahead of the game. So the ones again are heart disease and bone loss. Those are the two big ones that you can start to work on. But there are other consequences of menopause that need to be addressed, that can be addressed with your doctor. So if you are in the Houston area and you don't have a primary care doctor, or you're looking for a doctor to help with your health, check us out at InTouch Primary Care. We do things very differently here. The practice is set up in an effective and efficient manner, and most importantly, in a way that produces long-lasting results. So with our membership approach, receiving care is no longer stressful and reactive, but instead it's proactive and convenient. So if you are looking for a doctor to help you through the transition, you can definitely check us out at InTouch Primary Care for a convenient way to see a doctor. But regardless of where you are, there are 3 things you can do now, whether you are before menopause, that's premenopause, or you're going through that transition, that's perimenopause, or you've not had periods for over a year, so you're postmenopause. Regardless of that, there are 3 things you can start to do now. Number 1, eat a healthy diet. Diet high in fruits and vegetables will help, and also a diet that is very low in saturated fats. So things like red meat, baked sweets, baked desserts, fried foods have high saturated fats. So you want to avoid those. Why? Because that's what affects your heart. It affects your cholesterol, eventually affects your heart. It also increases it also affects your sugar levels, which increases your risk for diabetes. So low saturated fat diet, high fruits and vegetables, you can start doing that now. You can also eat foods that are high in calcium and vitamin D, or take a calcium and vitamin D supplements if you're not getting adequate calcium and vitamin D in your diet. So that can be started right away. The other thing you can do is try to stay active. Exercises such as walking can be very helpful for your heart. So 30 minutes up to 5 times a week. You can start out just 10 minutes every day, makes a big difference. And then you can also lift light weights. That's very good for bone health. So weight-bearing exercises can be quite helpful as well. And then the last thing is, if you are a cigarette smoker, avoid cigarette smoke. I often tell my patients that's the very best thing you can do for your health is to stop smoking. So that's another thing we love to help patients with, is how to quit smoking and going through the process. But if you are a cigarette smoker, you can work on quitting, and that will be very, very helpful. So 3 things you can do: eat a healthy diet, stay active. If you do smoke cigarettes, stop smoking. And as I said, follow up with your doctor to discuss your risks and to help you through this transition. So if you've made a decision today, go ahead and put it in the comments, or if you went and saw your doctor and found out about some of your risks, and let us know, and let's know what's going on with you too, so that we know how best, what other information to bring you. And again, if you're in the Houston area, you can find us at www.intouchprimarycare.com, www.intouchprimarycare.com. So thank you for joining us today. Remember, talk to your doctor, take charge of your health so you understand your risks and you're doing all you can. You can start by eating healthy, being active, avoiding cigarette smoke. And so we don't want your health to get in the way of enjoying all that you're working so hard for. If you found this helpful, please subscribe and share with as many people as you think may need it. Thank you. See you next week.